HighBridge, a division of Recorded Books, presents Your First Year with Diabetes, What to Do, Month by Month, by Theresa Garnero, Advanced Practice Registered Nurse, Board-Certified Advanced Diabetes Management, Masters of Science in Nursing, Certified Diabetes Educator. Read by Laural Merlington. Introduction. Diabetes is about change, changing your life from the way it was and bringing changes to your whole being, mind, body, and spirit. You can be healthy with diabetes, especially if you are consistent. Every day presents ample opportunities to make decisions that affect your well-being. This interactive book is designed to help you learn the latest diabetes science so you can decide what to incorporate into your routine. As Dr. Elliot P. Jocelyn famously said, "The diabetic who knows the most lives the longest." Yet, knowing and doing are two distinct entities. You can understand a topic, but for the science to have the best synergistic impact, you will need to pull apart the information and put back the pieces that are useful for your specific situation. The more you adjust and cope with having diabetes, the better you will be able to take things in stride and care for yourself. And despite your best efforts, diabetes management is demanding and rarely predictable, neat, or tidy. It requires paying attention to detail while trying to maintain a positive attitude, and sometimes you just don't feel like it. It's easy to get overwhelmed. You will have successes, and you will have slip-ups. That's normal. It's a process that takes time and patience, and you don't have to be perfect. Just be patient with yourself, be your own champion, and lean on your circle of support when needed. Although this book is geared toward people with type 2 diabetes, many of the self-care management tips will apply to all types of diabetes. You also will find some product-related information, comparisons of brand names of food, and websites that may be helpful. Please know that I do not receive any financial incentives to provide this information, and the American Diabetes Association does not endorse any of these products or supplies. I personally have checked out the resources, so you can have a greater level of comfort when making up your own mind. Please ask your healthcare provider for specific recommendations. It is my honor to be involved, even remotely, with your journey, and to share my unique perspective as a certified diabetes educator and humorist who knows the latest research and, equally as important, has experience with the real-life situation shared with me by thousands of people and their families dealing with diabetes. This repository of blended information offers you a positive approach to managing your diabetes and includes light-hearted humor. The art is in how you apply it to your everyday life while you continue to thrive in all the passions that keep you going. Let's get started. How to use this book. At the end of each section, choose what to focus on or write in your own goal and reflect on your progress. Health benefits happen by making small changes over time, and it's never too late to begin. Your First Year with Diabetes Roadmap. Another way to look at the year ahead and understand how the book works is to consider this schematic. Topics are presented in a need-to-know order that will have the biggest impact, will address safety, and will build in steps for success. You will reflect on goals and achievements with interactive activities and quarterly reviews. As the weeks and months continue, you will be presented with deeper layers of science and shared knowledge. When multiple topics are offered in a given week or month, review each one to see if it is relevant and important to you. If it is, you check out the details, Decide whether you'd like to take action by incorporating or continuing current behaviors, and whether you need help staying motivated. If not, you move to the next topic. Diabetes care is vast, and everyone has a unique situation, so some topics will have more relevance than others. This book is flexible in its setup. Along the way, you will learn about standards of care and tips to refine your abilities, as well as ongoing resources that will be helpful for your first year and beyond. Week 1. Day 1. Mind Matters. I was told I might have diabetes. Now what? Take a deep breath. Preparing your mind for your journey with diabetes is one of the best first steps to take. Being told you have diabetes, or that there is a problem with your blood glucose level, or that you have pre-diabetes can cause quite a bit of stress, and rightly so. Diabetes can be scary. You may have read headlines about what can go wrong, or witnessed firsthand the negative effects of uncontrolled diabetes. Maybe you have been in denial that anything is wrong. That's okay. Denial protects and buffers you from difficult or shocking information. Do you feel guilty, like you caused diabetes? If so, your first assignment is to stop the blame game and get on your own side. Anger, too, is a common reaction and is often the first sign that you acknowledge that something is wrong. It is never too late to jumpstart your diabetes self-management program. The key is to be gentle with yourself, because you are your best resource for managing your diabetes. Diabetes is never convenient, but with some effort, help from the experts, and support from your personal community, it is manageable. It is important that you acknowledge this. How you perceive this diagnosis will greatly affect the level of success with which your diabetes is managed. Your thoughts and feelings have an enormous impact on the body. Positive thoughts have positive physiologic repercussions in the body. So let's check in with your current emotional state. Why? Making and maintaining a change often depends on your emotional state. Your feelings about diabetes will change day by day. All emotions are fair game. What you do with them is up to you. What are some ways you are willing to deal with the stress of your diabetes diagnosis today? Personal goal. Using a pen and paper, jot down today's date. Blank. I will allow myself to be angry over my loss of spontaneity. Take a time out, see a movie, go for a walk or scenic drive. Meditate. Listen to a favorite piece of music. Start a journal. Stop harping on myself. Plan on imperfection in both daily life and life with diabetes. Close my eyes, take a deep breath, and go on a 2-minute vacation, visualizing my favorite getaway spot. Enjoy a bubble bath. Find 5 things that bring me joy. Other. Blank. The good news is that I am coping. The bad news is that I maxed out my credit card. Day 2. Diagnosis: diabetes. What is diabetes? Although diabetes means you have too much blood glucose, it is the end result of a complex hormonal issue that relates to the body's ability to make and use insulin and to get energy from foods. When we eat, food eventually turns into glucose, the main source of energy for the millions of microscopic cells in our body. The only way for the cells to get this glucose is with insulin. Insulin is made by specialized beta cells within the pancreas. The pancreas is a gland situated behind the stomach. It releases insulin into the bloodstream in response to the blood glucose rise after meals and snacks. Insulin is the key that unlocks the cell door to allow the glucose to enter where it is used for energy. In people with diabetes, the pancreas is on an early retirement plan, so less insulin is available in the body. In addition, the body doesn't use the remaining insulin well, resulting in glucose piling up in the bloodstream. If left uncontrolled, these high levels of glucose in the blood eventually cause problems throughout the body. Luckily, you can change the course of this disease and prevent the laundry list of possible complications through your everyday behaviors. You can even be the healthiest person on your block. Understandably, you may be worried about the risk of getting diabetes-related complications. Diabetes health comes from applying relevant research and professional knowledge to your individual experience and everyday efforts. Some of the risk for complications is controlled by genetic factors, so you do your best on a daily basis to combine what is in your control, your environment, sensible eating, being active, and, if needed, taking medications, with what is not under your control, your genetics or inherited traits from your parents and ancestors. By the time type 2 diabetes is diagnosed, up to 80% of the beta cells may be destroyed. You can help protect your remaining beta cells by making mindful food choices, being active on a regular basis, and, when needed, taking medication. Compounding the issue is insulin resistance, which is common with type 2 diabetes and often occurs with individuals who are overweight. When someone has insulin resistance, cells do not respond to circulating insulin, whether the insulin was released from the pancreas or taken in the form of an injection. This means the lock on the cell is stubborn, and insulin, the key, has difficulty opening it. Thus, blood glucose levels go up. Left untreated, blood glucose levels go even higher. Lack of exercise, obesity, smoking and second-hand smoke, high blood glucose, sleep problems, stress, and hereditary factors all play a role in the development of insulin resistance. Some language trivia. Our word diabetes originally comes from the Greek word for siphon. When blood glucose levels are high, water is pulled from the cells and put into the bloodstream, which explains why some people have increased thirst and urination as symptoms. The gray zone. Prediabetes. Prediabetes is a condition in which glucose levels are rising but are not high enough to be categorized as type 2 diabetes. See the section, How is it diagnosed? Research has shown that people with prediabetes are at a high risk for developing type 2 diabetes, which often can be prevented or delayed by getting 150 minutes of physical activity a week. For example, 30 minutes of physical activity 5 days a week. And for those who are overweight, by losing 7% of weight. For example, if you weighed 200 pounds, that would mean losing 14 pounds to reduce your weight by 7%. Why did I get diabetes? No one can be sure. Even though millions of people have it, each individual's case is different. Some scientific theories suggest that an environmental trigger activates a genetic code, flipping the diabetes switch to on. How did I get diabetes? I don't eat a lot of sugar. It is not as simple as sugar consumption. It's part genetics and environment, and sometimes the cause is not known. In terms of genetics, do you have any immediate relatives with diabetes? Recent studies have shown that many people have diabetes for 7 years before they are diagnosed, so family history of the disease is not always obvious. Have any of your relatives suffered a heart attack or a stroke? Either could arise from undiagnosed type 2 diabetes. Many people with type 2 diabetes do not have any signs or symptoms of the disease before getting diagnosed. In terms of environment, did you know drinking just 1 soda per day may increase the risk of diabetes? If you gain weight from consuming too many calories, whether from sugar or something else, or lack of physical activity, and if you have a genetic predisposition for diabetes, then that can trigger it. What type of diabetes do I have? There are many types of diabetes, including type 1 diabetes, type 2 diabetes, latent autoimmune diabetes in adults, LADA, and gestational diabetes, also known as hyperglycemia during pregnancy. How is it diagnosed? Diabetes is diagnosed by measuring laboratory blood glucose levels in one of the 3 following ways. 1. Fasting glucose, blood taken first thing in the morning after no food or calorie-containing drinks for at least 8 hours. 2. Non-fasting glucose, blood taken at any time of the day, regardless of what you ate or drank. 3. A1C or estimated glucose average, an average blood glucose from the last 3 months. Knowing which type of diabetes you have helps you get the proper treatment. After talking to my healthcare provider, I discovered that I have this type of diabetes. Blank. Is diabetes contagious? No. Diabetes is not contagious. You cannot catch diabetes from someone or give it to someone you know. Your relatives may have given it to you through your genes, but that is very different from catching a cold. The almighty A1C. The gold standard for checking overall diabetes management is a blood test called the A1C test, often referred to as HbA1c or hemoglobin A1c. It measures your average blood glucose levels over a 3-month period and is reported as a percentage or an estimated average glucose, EAG. On your lab printout, you may find the EAG, which expresses A1C in the same units as glucose meters, milligrams per deciliter. This is intended to make it easier to understand how the A1C relates to your glucose values. The A1C test measures how much glucose is stuck to the hemoglobin part of the red blood cell. Red blood cells live for 2 to 3 months, carry oxygen and nutrients throughout the bloodstream, and carry away the waste. When a glucose molecule is nearby, it attaches to the red blood cell and won't let go. That's how we can tell what has happened for the past 3 months. The goal for many people newly diagnosed with diabetes is to have an A1C of less than 7%. An A1C of 7% compares to an average blood glucose level of 154 milligrams per deciliter. Talk with your provider about your individualized A1C goal. Less stringent A1C goals may be appropriate for those with a history of severe low blood glucose, discussed on Day 10, the very young, limited life expectancy, those with long-standing diabetes difficult to control, or those with other conditions, such as cardiovascular disease or complications, such as eye and kidney-related disease. Also, consider that if a person is anemic, for example, he or she will have fewer red blood cells, rendering an A1C test inaccurate. It is typical to have a high A1C when you are first diagnosed and to have the value fluctuate over the years. Keep in mind that even though the A1C is a very important number, it does not define you or all of your efforts to be healthy with diabetes. Type 2 diabetes. Type 2 diabetes is the most common type of diabetes and is caused by the body's resistance to insulin and a decline of insulin production. Type 2 diabetes typically arises in adults, occurring most often in 45 to 64-year-olds. Children and teenagers also may develop type 2 diabetes, especially if they are overweight and have a family history of diabetes. Treatment often requires medication, including pills, injectable medication, or insulin. The symptoms often are subtle, varying from none to tiredness, especially after a large meal, blurred vision, frequent urination at night, and dry, itchy skin. Type 1 diabetes. Type 1 diabetes is an autoimmune disorder in which the body mistakenly destroys the insulin-producing beta cells, causing insulin deficiency. Type 1 diabetes was once called juvenile diabetes because most diagnoses occur with children and young adults, but not always. Insulin therapy is required. Additional laboratory tests used to check the type 1 diabetes include C-peptide, islet cell antibodies, ICA, insulin autoantibodies, IAA, glutamic acid decarboxylase, GAD, and zinc transporter 8, ZNT8. The symptoms of type 1 diabetes are typically obvious: profound thirst, frequent urination, hunger, and rapid weight loss, and may include nausea, vomiting, or abdominal pain, a hard time breathing, fruity odor on breath, and confusion. Latent autoimmune diabetes in adults. Latent autoimmune diabetes in adults, LADA, has components of both type 1 and type 2 diabetes. The autoantibodies that cause beta cell failure are present, but the process is slow. Individuals with LADA often are misdiagnosed with type 2 diabetes and only go on insulin therapy after oral medications are proven ineffective. If you were mistakenly diagnosed with type 2 diabetes under the age of 50 years, have a BMI of less than 25 kilograms per meter squared, are not responding to diabetes pills, or have a personal or family history of autoimmune disease, ask to have your islet cell antibodies checked. Gestational diabetes. Gestational diabetes is a condition in which high glucose levels start or are recognized during pregnancy. Pregnant women typically are screened for this at 24 to 28 weeks gestation. Treatment includes carbohydrate counting, glucose self-monitoring, exercise, and medication or insulin. Maintaining optimal glucose levels prevents problems: baby growing more than 9 pounds, risk for delivery complications, or, later, childhood obesity and type 2 diabetes. Because there is a rapid increase in the cumulative incidence of type 2 diabetes occurring in the first 5 years after delivery, maintaining a healthy body weight, by losing weight if needed or preventing weight gain, through mindful eating and being active, helps to prevent or delay type 2 diabetes. Personal goal. Date: blank. I will. Ask my doctor's office for copies of my laboratory tests, blood glucose and A1C, to learn what results got me the diagnosis. Get organized with my health records by keeping all lab results and important contact information in a binder, or file them electronically in such a way you can actually find them later. Ask to have an A1C blood test, if not done in the past 3 months. Acknowledge that I have diabetes. Reach out to someone I trust for encouragement. Calm my mind with 3 deep breaths. Other. Blank. It's official. I'm really sweet. Day 3. Eat wisely. What can I eat? Living successfully with diabetes is about making wise food choices more times than not without compromising the joy surrounding mealtime. But it's easier said than done. We are creatures of habit, We are used to doing things a certain way. It's not about eating like a saint. It's about making small changes over time to eat more nutritiously. It's a process, not an event. The step-by-step guide that follows gives you small bites of information at a time. We'll start with general concepts and specific take-home points that you can start using today, with more and more details unfolding throughout the months ahead. What actions are you willing to consider from the diabetes education buffet? Here are suggestions backed by research that you can incorporate into your daily life. Eat better and feel the difference. After you eat, your blood glucose level goes up. Foods containing carbohydrates, also known as carbs, raise glucose the most. A lot of people are fearful of carbs as a result. We need carbohydrates for brain function and energy, so please don't cut them out entirely. 1. You can have carbohydrates, but stick with sensible portion sizes that are consistent from day to day. 2. Choose a variety of foods that are rich in vitamins and minerals and low in calories. 3. Eat regularly. This means 3 meals a day and snacks, if needed, 2 to 3 hours after a meal. 4. Skipping meals may cause blood glucose fluctuations, and eating too much late in the day may cause weight gain. 8. Products that claim that they have no added sugar or are sugar-free often still have carbs. 6. Check food labels, that is, the nutrition facts label, for serving size and the total carbohydrate amount to start learning about carbs. 7. See a registered dietitian who has an expertise in diabetes. Often this is a certified diabetes educator for an individual meal plan. Preparation methods. Choose often: bake, broil, roast, steam, grill. Choose less often: fried. Breads, grains. Choose often: whole grains, specifically brown rice, barley, whole wheat bread, oatmeal, wild rice, small whole grain bagels, and bulgur. Choose less often: white bread, muffins, croissants, biscuits, white rice, French bread, and sweetened cereals. Starchy vegetables. Choose often: peas, corn, winter squash, baked, mashed, boiled potato. Choose less often: French fries, instant mashed potatoes. Non-starchy vegetables. Choose often: broccoli, bell peppers, mushrooms, zucchini, celery, spinach, eggplant, and greens. Choose less often: tempura or fried vegetables with added fat, vegetables in sauces. Fruits. Whole fruits, small portions, dried fruits without added sugar, and frozen fruit. Choose less often: juice, regular or with added sugar. Eat fruit instead, or add water to dilute it. Canned fruit with added sugar. If this is more affordable for you, be sure to rinse it first. Milk, dairy. Choose often: non-fat plain or Greek yogurt, no sugar added light yogurt, non-fat or low-fat milk. Choose less often: whole milk, half and half, ice cream, milkshakes, low-fat sweetened or regular yogurt. Meat and meat alternatives. Choose often: skinless, white poultry, lean beef, pork, trim off fat, fish, seafood, natural peanut butter, tofu, gluten, legumes, beans, peas, lentils. Choose less often: bacon, sausage, ham, luncheon meats, poultry skins, fatty meats, hard cheeses, breaded or fried fish, chicken, meats, tofu, gluten. Fats, oils, seasonings. Choose often: liquid oils, canola, olive, soft tub margarines without trans fat, nuts in small amounts, 1/8 avocado. Choose less often: butter, lard, solid fats, sour cream.
Sample complete. Ready to continue?